to show you guys the procedure to fill the Class II composite with composite on this number 20, which is one of the teeth you might get for the ADEX. So we have rubber dammed the quadrant over here, and I've used a number 24 clamp over, and we have a MO prep on number 20. So I'm going to go ahead and use one of these kidney shaped sectional matrices, and we're going to tuck that in like that. And one of the keys is that you get the occlusal aspect of the matrix at the marginal ridge level of your tooth. So I'm going to put my thumb on this matrix right here so that the top of the matrix is at the marginal ridge level of the tooth. And we're going to go ahead and place the wedge. I've gone in from the lingual, and there it is, our wedge is inside. And what you want to look for is that you have a good seal at the cervical aspect of this tooth. If you don't like how this fits or if it's loose, I would take it out and do it again until you have a proper seal. There, that looks better. We have a good seal over here. So what I'm doing is I'm looking inside right here and making sure that the matrix is completely sealing in my cervical part of the prep. Now, one thing you can do if you don't have a good seal is use a wider wedge, so you can try that. If you still are not getting a good seal, so if you had a preparation that was still open at the cervical, you can take your matrix and wrap some Teflon tape around it. That'll widen it and thicken it for you, and then you can try that in. Best is when you are prepping, pre-wedge your tooth, and that will help shape your wedge to the shape of your tooth, and it'll also push your tooth away from the adjacent tooth so you don't nick the adjacent tooth and cause damage. And the Garrison ring over here has a notch on the underside of it right here, and this notch is going to strap the wedge that you had placed. So it has a notch on both sides. So there, now I've isolated this. The top of the matrix is pretty level with the marginal ridge, and I have a good seal. I'm looking at the cervical aspect, like the gingival floor, as well as sort of the lingual and buccal walls of the prep, and everything is sealed in. There's nothing open. Now the next thing I want to check is that I have a decent contact here. So I'm going to make sure that this sort of handle part of this matrix is not doubled over. And then I'm going to take some sort of burnishing instrument and just push my contact in here so that I have a nice good approximation to the adjacent tooth. I'm going to look at it for anatomy. Do I like how this is going to be shaped when this is over? Is it going to mirror the marginal ridge anatomy of the adjacent tooth? You're looking for symmetry here. So if you look at the emergence of this marginal ridge as it comes out, you want to sort of mirror that symmetrically on the other side. So I'm going to take some adhesive here. Now, if this was a real tooth, you would etch, but here we don't need to etch. So we're using an OptiBond adhesive. This is the second step of the adhesive. You can apply your bond in here, and then you have two options. You can take your air water and just spray air in here to make sure you don't have excess. You can also blot it out, so then just dry this tip and put it back and just remove any excess, because you don't want to create a gap because you have too much bond in here. But make sure you're coating all of the walls of your prep. So for the fill, you have two options. One is to use a flowable composite to line the walls on the floor first. And this is how I'm going to do it. You don't have to do this. You can go ahead and fill with a packable right away. But if you're going to use a flowable, you want to just coat everything, and this might help ensure a proper seal so that you don't have any gaps, especially in these corners of your prep. Take an Explorer or Perio probe or something and just make sure this is sort of flowing everywhere that you want it to flow, and that you don't have any bubbles in it. That's important. So once I'm done with that, I'm going to go in with my packable composite here, and I'm going to dispense just a little bit, and my first goal here is going to be to get the sort of proximal wall done. So I'm going to take a plugger, and these preps are pretty small, so you probably want a pretty small plugger here. Now, this step, if you don't have a good seal of your matrix, this is going to end up being a big disaster for you because you'll have a lot of excess. But if you know that your matrix was sealed properly, you should be able to push this in here and create your marginal ridge. You don't have to start this way. You can start by packing in the other direction. What I like about this technique is that you're more likely to end up with a good tight contact. Having said that, the Garrison rings are really great for that. They create a very tight seal and push the two teeth apart, so they help in forming a contact. Before I cure this, I usually try to create the occlusal embrasure, basically the rolling of the marginal ridge against the adjacent tooth. And I'm looking at this and making sure that this marginal ridge height is pretty equal and level to the adjacent tooth. Now at this point, you can technically, you've created your wall, so you can actually remove your Garrison if you want to. And you're done with the sort of the proximal angle, and you can take a look at it and make sure that you like that area. Now you've turned your Class II restoration into a Class I. This is a pretty tight wedge. So there it is. So now we can sort of look at this, and it gives us an opportunity to evaluate this contact before we kind of fill the proximal. If I didn't like this, I would stop and cut this out and do it again, but it looks pretty good to me. I have a good seal. I'm looking down here to make sure that the composite is filling the cavity that we had fully, that I don't see any openings. I'm going to use my Explorer and just kind of feel around here. It looks really smooth. I can see visually that I have a good contact. And I can see that the emergence is nice, that it's coming up from kind of the cervical part of my prep in a really nice smooth fashion, and it's sort of mirroring the anatomy of the adjacent tooth. I also like the width of it over here. I think it's looking good. We have a little bit of flash here, which is probably the bond, and that's fine. We can clean that up later. That's not a big deal. So now I'm going to go ahead and fill this occlusal portion. So we have this Class I that we've created. When you're doing these fillings, you're looking at anatomy. So I'm always looking at the adjacent teeth and looking at the angulation. So we're trying to create a fossa basically in the middle, and then to bring that up and create our anatomy so that the lingual walls, or the lingual slopes and the buccal slopes of these cusps are following the anatomy of the tooth. So you want to hold whatever instrument you're using. You can use a plugger, you can even use a plastics instrument over here and do the same thing. But you want to hold it so that you have part of it sitting against your natural tooth that you haven't prepped, and part of it is sitting against your filling. So first of all, actually, before you do that, make sure you've packed this down so that you don't have a void inside or anywhere along it, because later when you adjust the occlusion, you don't want to end up with, you know, a hole there. And then once you've done that, you can just follow the natural anatomy of the tooth and remove your excess. This doesn't have to be perfect, but you don't want to have a deficiency. So if you're not sure, leave excess here, and then you can clean it up when you're polishing and adjusting occlusion with your burr. I'm almost burnishing this a little bit. And just removing as much excess as I sort of can see from the top of the tooth. I'm also forming some of the anatomy. So now I'm going to just stop and look at this and sort of compare it to the molar over here. So I'm looking at this emergence of my filling to the cusps, and does it kind of follow this natural contour. Now, because this is a pretty small prep from buccolingually, it's pretty easy to do this. If you had a wider prep, then you really want to focus on this, and you might end up with that. Some of these teeth have pretty big cavities in them that you have to remove. Just put your instrument against the adjacent tooth and just follow that path so that you end up with the same angulation. So I think this looks pretty good. We're filled in. Everything is looking sealed and clean, and the anatomy looks pretty decent. So I'm going to cure it. Looking good. The first most critical thing is to make sure we have a decent contact. So I'm going to take my floss. That feels good to me, and it's pretty smooth. There's a little bit of fraying of the floss. So I'm going to use this gold foil instrument. This is called the GK14L, and it's used to remove flash. So you make sure that if you're doing this, use a sharp one. And I'm going to go in here where I see.
Your hand was blocking the, yeah, I don't know, just try to show it exactly.
So I'm going to use this gold foil instrument to remove the flash. I see a little bit of flash here on the buccal.
Can you show the point of contact of the instrument?
So you want to be very careful to not dig this into the filling, but just to kind of run it across.
Try to tilt it. Yeah, now it's good. Now it's good.
So I'm doing the same thing on the lingual here. I'm going to go in and just make sure that there's no flash over here. The next thing that you can use is a strip. These are interproximal strips. This is a metal one.
Bring it down a bit. Yeah.
So these guys come in different colors. This is a blue one, which is a rougher one. You can also get red and yellow ones. And these have a section in the middle that is non-gritty. And then on either side, it's got a kind of a rough surface. So in order not to remove any of your contact, you want to use the non-gritty section right here. And also, they come in different widths. So when you're doing it on a Class II over here, your goal here is to get underneath this contact point and to polish this area beneath your contact. So you need your strip to be relatively narrow so that you don't end up gauging or going inside of the gingiva here and cutting that up, and you don't end up removing your contact either. So you're going to take the non-cutting surface of it, and you're going to shimmy it in here. Now we have a pretty tight contact, so this is hard. But now I'm underneath that contact. Now I can bring this over to the kind of cutting surface, and using my fingers, I'm just kind of pushing it against that proximal surface to remove any flash that was there. So there it is inside, and I'm going to smooth into that area right there. And then we can also bring it over so that now the lingual part that's cutting is over here, and continue to smooth that. Now we're getting sort of the line angles of the teeth smoothed off. Once we're happy with that, we're going to go back to the non-cutting area and just push that out. I'm going to recheck my contact to make sure it's still tight, that I didn't remove any of it. Feels good, and now I'm not getting any more fraying of the floss because we smoothed that out. We're going to adjust the occlusion next. Now before I start banging on this tooth with the opposing arch, I'm going to make sure that the marginal ridge is level with the adjacent tooth, because if you have a tooth over here and your filling is pretty tall, if you start trying to adjust the contact by checking it, you might actually break some of your filling off. So make sure before you start sort of putting pressure occlusally on this tooth that you level it. Now this isn't too bad. It's a little bit taller than this. So I'm going to go ahead and just adjust it a little bit, and then we will check contact in occlusion. We've just finished placing this filling, and I've used a finishing strip to make sure that I don't have flash and the contours are correct on the interproximal area. Now before I start checking the occlusion, what you want to do is make sure that your filling is not super tall so that you don't end up breaking it when you start checking occlusion and banging the opposing arch into it. So I like to take a look at this and make sure the marginal ridge is pretty close to the height of the adjacent tooth. So I'm adjusting a little bit. I'm using a white stone here that has a point to it. Okay, so I'm liking that. I'm going to go ahead and remove the rubber dam here. So we've taken the rubber dam off here, and now I'm going to start checking my occlusion. I have some occluding paper right here. I'm going to put that . So I'm going to take a look at that, and I'm looking for the marks to be about equal in kind of intensity to the adjacent tooth, and they are. And then the next thing I'm looking for is that I don't have any high spots. So when I look at this right now, I see that right here in this marginal ridge, I have a contact point. Now, having contact points in your marginal ridge can be acceptable, except in this situation, none of the marginal ridges of these teeth have occlusal contacts. So in order to stay in harmony, I'm going to remove that, because to me that's a high spot in this situation. That's the first thing we'll remove. And then the other thing is we want to remove any contact points on the inclines of the slopes. So we want to have the contacts just be basically on the occlusal part right here and right in the middle of the marginal ridge. Again, this mannequin doesn't have any occlusal contacts in any of the sort of occlusal grooves here. So I'm going to remove that and just try and keep the ones that are on the cusp tips, just to kind of match the anatomy of the teeth. So I've gotten rid of the contact point that I had in the marginal ridge. Again, I'm comparing to the adjacent teeth. I see some occlusion right here, and I don't have it in the central groove of any of the other teeth, so I'm going to take it out. That's looking better. Now, if you've noticed, initially we had one point. I took that out, then we had another point in the center. I took that one out, now we have new points. So I want you guys to realize, especially for those of you who are not clinicians who have a lot of experience, that often when you're checking occlusion, you won't see all the high spots. You'll see just the heaviest or tallest high spot. And once you reduce that, you're going to start to see more and more. So that's how you know that your occlusion was quite high. Even if you just see one point of contact, don't just reduce that and move on. Recheck, because new high spots are going to start appearing for you. So what I'm trying to do here is just to remove any contacts on the angulations of the cusp walls. So on the lingual incline of, or sorry, on the buccal incline of the lingual cusp, there was a spot there. So I just removed that. Now I'm going to go ahead and just kind of make this anatomy a little bit more ideal. I'm doing all of this with a white stone. If you're more comfortable using a burr, you can do that. A burr that I would recommend for this is just a carbide football finishing burr. That's this one right here. So you can use that. Let's go ahead and check the occlusion one more time. So I see a high spot right here on my marginal ridge. I'm going to take that out. Now if you're going to use something like this, you got to be careful. This is going to make a bigger hole. As I'm adjusting this, I'm also creating some marginal ridge anatomy here. So there we go. So right now, the contacts looks good occlusally. I don't see any high spots. I'm going to go ahead and polish this and recheck. When you apply bond, especially if you're applying bond and air drying it, you might get a layer over the entire tooth. So what you really want to do is polish the entire surface. So don't just polish your filling. You also want to be able to polish the rest of the tooth so you remove that layer of bond, which might make the entire thing look high. But before I start polishing though, I want to make sure the anatomy is beautiful. So I'm going to take a needle finishing burr, carbide. And I'm looking at this marginal ridge and it's sticking up a little bit. I'm going to use this to refine this. So in order to polish, I'm going to use a slow speed here, and I have a composite polishing burr on here. So I'm going to take my Explorer and just really check all of this, make sure I don't have any flash. I think there's a little bit right here in this sort of lingual groove. So I'm going to go back in there and polish that. Now, if you had done this filling and your marginal ridge was really tall, really high, your contact might have been tight when you started. But as you adjust your occlusion down, you may lose that contact. So at the end, just go ahead and recheck. Make sure you have a decent contact. Before you hand this in, you want to check for any deficiencies. So really take a look and make sure that you don't have any gaps or openings, that everything is sealed, that you don't have any flash, that your filling is sealed and there is no gaps at the cervical area. Everything looks smooth. You've checked your occlusion, and that the anatomy of this looks pretty good and it looks kind of cohesive with the adjacent tooth. So you're looking for symmetry. So you want this marginal ridge to sort of mimic your marginal ridge in shape, okay? And when you're looking at your filling from this angle, you want to make sure that these cusp heights, these inclines of your cusps are about the same as the molar behind it here and the premolar in front of it. So there you go. That's your Class II composite fill of a posterior. Good?
Good.
Nice.